I'm joined now by Carolyn Ayala. She is the Microbiology Coordinator at St. Vincent Hospital and Medical Center. Thank you so much for being with us. As we understand, testing is really key to so much right now.
Yes, thank you very much for having me. Testing is very important. With any infectious disease, we want to get the results to the patient as quick as possible, not only for patient care, but also for correct isolation for positive patients, and also getting negative results out so patients can be taken off of personal protective equipment, which is very precious. Testing turnaround time has been very long at some point, 5 to 10 days. We have managed to get it down to 24 to 72 hours. And more recently, we have acquired an instrument that will allow us to do testing in 45 minutes.
45 minutes is wonderful. I know people in the beginning here were waiting weeks. Are you finding that it's reliable?
Yes, so far it's only been up a couple days. We did a 70-patient validation study on it. It correlated well. We also because we have limited supply, we cannot use it for bulk testing, so we are limiting it to just special circumstances at this point. When it opens up and we have more testing available reagents, we will be able to test more patients quicker.
We know that testing's been in the news a lot, and I think people are still confused of why it's an issue. Is it an issue that you can't get enough swabs, or why can't we get to the level that doctors want us to be at?
Well, it's a combination of both. The swab inventory was very low to begin with because of the worldwide usage of it, and also companies shutting down in Italy that made these swabs. So swabs became a challenge to find enough of them. We also tried to bring in different types of swabs to circumvent that issue. Yep. A swab is different for a viral culture versus a bacterial culture, so it's not easily transferable from one swab to another. The second part is it's the coronavirus, COVID-19, is a new virus, and testing was not out there for it. It started at the CDC. You would have to send your sample down to the CDC to get tested, and then changed to being able to send it to the state when they released the testing to the state. But everybody sending these tests to these one laboratories overwhelmed them. And they were running out of reagent. They also were backlogged in timing, trying to get them all done. So that increased the turnaround time. With the emergency release from the FDA, other manufacturers have been developing tests platforms, which is helping the issue. So right now, St. Vincent's works with 2 laboratories to get testing done quicker. We are working also on getting a 3rd laboratory on board. And lastly, we got our own in-house testing, which is 45 minutes.
Right, the 45 minutes is great. I want to ask for our viewers who are watching on Facebook right now, because so many people are concerned about the testing. Would you say that anyone who needs to get a test right now can get one?
There's plenty of drive-thrus. We have one at St. Vincent's, and we will be opening one shortly in Westport. They should, if they have any doubts about getting tested, so they know how to isolate themselves if they think they're positive, or if they are okay to go back to work if they have a negative result.
So would you, sorry, that's the Facebook Live feed that's echoing back here. I'm just trying to make sure that people who have a question. Helen has a question. My question is, the doctor's offices are closed and they have supplies like swabs. Do you think they could donate them to testing sites like you?
Yes, we will take all swabs. We will evaluate them whether they are appropriate for the testing, but we are taking in any kind of swab donation that somebody would like to give to us. And we've had a few so far, and it definitely helps out the situation.
Based on what you're seeing, and you have a frontline view, where do you think we are as far as the ability to reduce social distancing?
I do see a turn in the results that we were reporting out. This morning I reported out over 70, and most of them have been negative, happy to say. which was a complete different picture from a few weeks ago where most of the results I was reporting out were positive.
So that is a positive result. And I know the governor is talking about using people like you, microbiologists and scientists, to help make sure we can do contact tracing and testing. On a scale of 1 to 10, where do you think we are now, assuming that we need to get to that 10?
Well, I wouldn't want to jump the gun too quickly. Infectious diseases are invisible, and you don't know that they're still out there. So it would probably be best just to hold off a little bit longer, just to make sure those viruses have died out and not on the surfaces or easily transferable from each other.
Is that what you see happening? Do you think the virus is dying out, or we're just not spreading it as much because of the social distancing?
I think it's a combination of both. We're aware that it is out there and the precautions everybody's taking with hand washing, wearing masks, social distancing has contributed to it. And if they are on surfaces, eventually they will die out, and people are knowing to use their disinfectants in every situation, especially if they're out in public settings like grocery stores or gas stations.
A lot of talk is about when we could send our kids back to school. From a scientist perspective, from where you sit, kids always touching each other and things. What's the concern? Do you think we can send kids back to school sooner rather than later, or that's a big problem?
I would be very careful with the calling that one. They are in close contact with each other, especially the younger children who may not be aware of what they are doing, touching each other and cleaning up and washing their hands. That is something that would probably be left to an epidemiologist to get all the data before giving an answer on that.
Are you seeing this, if I gather what you're saying, though, is from where you sit, things are getting better, though. You're seeing a reduction, you're seeing a flattening of the curve, you're seeing more resources, all of those good things?
Yes. And also we are experiencing patients that even though they test negative, they do have symptoms. And there could be a variety of reasons why they still have symptoms, and this testing is not picking them up. So testing is important, but it also should be in combination with the patient's symptoms as well.
Yeah, that makes sense. I do know someone who tested negative who really thought that they could have had that virus. Is there a period of time, if you wait too long to get tested, that it won't show up? Or do you need to make sure you wait long enough because it has to build up in your body?
In the beginning, your viral load may be low, so you'll test negative. That could be an issue. Also, if the test itself didn't get a good sample, there's 2 different ways to sample for coronavirus, nasopharyngeal or oropharyngeal, and if that sampling isn't done, that could be a contributing factor. And there's also, with any infectious diseases and testing, there are mutants or varieties out there that may not be in a test system to detect these particular organisms that are similar but not the same strain. And that is one of the fails on the testing part.
Okay. And what about blood testing? Are we getting there yet? Is that more accurate and looking for antibodies?
It is out there. There's quite a few manufacturers trying to come into market. I've heard that you have to be very careful on what manufacturer you choose because it needs to be FDA regulated. And because it's been an emergency release on both the testing and as far as the nasal swab or pharyngeal swab and the serological testing, you need to really take a step back and make sure you have a good system and validate it correctly so you know you have a correct answer. And serological testing doesn't necessarily mean that you have a current infection. It means that you couldn't be exposed to and you built up antibodies.
Have you seen that or read that yet? Are we seeing people who maybe do have the antibodies and don't recall ever being sick?
Oh, yes, I'm sure that is possible. People get the disease in various different intensities. Some people, our immune system is very strong and is able to fight it off, so they would have minor symptoms and they would test as positive with their antibody screen.
Early on, it was the story about this virus was all about the concern for elderly people, and of course that is still a concern, but you have seen this evolve. Have you now seen many people get sick and many people test positive that are of all different ages or even all different levels of immunity?
Yes, we had our first case actually was a younger person in their 20s that actually was very ill from it. So it does affect the younger population as well, but probably not as prevalent as in the older population.
And if you could just tell people, some people are commenting on Facebook that the Q-tip in your nose actually hurts a lot. Is that how we're tested, or take us through getting tested? What happens?
Yes, it's unfortunately, in order to get a proper sample type, you need to really get far back into the nasopharyngeal part of the nose to collect a good bite. That's where the virus is replicating the most.
Okay, so it's not like just a Q-tip on the outside. It might be a little bit of pain in there.
Yes, it is. It's like a punch in the nose.
Okay, good to know. Good to know. Well, we want to thank you for your time and giving us a window into the testing, and we look forward to hearing more about that 45-minute result. That seems like that could help you guys a lot.
Yes, we're very thankful that we got this testing methodology in-house. It's going to be very helpful in moving patients around and getting them discharged quickly.
One more question before I let you go, because you are on the front line and we're hearing different stories about PPE. How is your supply right now?
We monitor our PPE judiciously. It's doled out. Every department gets a certain allotment. We really want to keep it for the frontline workers, the special N95 masks for the doctors and the nurses and the phlebotomists and respiratory therapists who are caring for them. We are doing the best we can to save them and come up with alternative solutions to actually recycle them.
Okay. We appreciate your time and thank you for giving us some great information.
Oh, thank you.